Dr. Austin Nabet, and I am an orthopedic surgeon with Atlantic Orthopaedic Specialists, and I take care of adult hip, knee conditions mainly, but I treat all parts of the body. So I really focus on rapid recovery joint replacement, so getting people back to the activities they love much quicker. So I think in doing that, there are a few tenets of my philosophy, and one being muscle and tendon sparing joint replacement. So that's really related to the knee and hip, and not cutting any muscle or tendon allows for much quicker mobilization. The second part of that is really doing an individualized plan with the patient. There are several philosophies out there. One is kinematic alignment, and your goal there is to restore the patient to their pre-arthritic joint line, so how they were before they got arthritis. A lot of philosophies out there aim to do a standard alignment philosophy where the leg is made straight in most cases, and not everyone was born like that. We're all different shapes and sizes, and we should be treated as such when we do a joint replacement, particularly in the knee. And doing such philosophy, I think, restores normal anatomy, gets them back quicker recovery, and it's just more natural feeling. Typically, most people go home the same day after surgery. While you're at home, you're really working on swelling control, walking, and range of motion. We get you into physical therapy that first week or so after surgery. Most people are feeling pretty good by 2 weeks. Most people are back to most activities by 6 weeks. I advocate for a muscle-sparing anterior approach hip replacement, which has been a game changer, and I've been doing it for almost 10 years now, and it's allowed people to get back to activities really quickly. So while I was at Portsmouth Naval, we completed the first robotic total knee replacement at the Naval Hospital ever, and we secured a robot for the hospital and performed those robotic surgeries. One of the most powerful stories I had a gentleman that I did a hip replacement on a few years ago, and he hadn't walked in 7 years. He was in a wheelchair, horrible hips. He was told by multiple orthopedic surgeons, you need to lose weight, you need to do X, Y, and Z, you're too unfit. Well, I partnered with the patient, said, you do these things, I will do your hip replacement. He met me halfway on it. We got his hip replacement done, and he stood up and walked to the bathroom when I went and saw him that day, and he started crying. He said, I haven't walked in 7 years. So those kind of things are, super powerful, because you gave that man his life back, and he's not confined to a wheelchair. The small wins are what keep you going. So, but I enjoy talking to people. I enjoy my patient population. I enjoy taking care of generally people heading towards retirement or in retirement, and keeping them doing the things they want to do, playing golf, tennis. These are all the things, doing the things you love to do day to day, and that's important, right? So being able to affect someone's life in such an immediate kind of way is really why I'm an orthopedic surgeon.